Hi, this is Lorena, and I've been working as a trainer in the AMORAY project. I've got 4 or 5 years experience working with refugees and asylum seekers, and at the moment I'm working with human trafficking. Back when I was working with Refugee Council, I started working as a children advisor. So I was supporting unaccompanied asylum seeker children, and just supporting them with solicitors appointment, making sure that they were safe and happy in their foster care families or with their social workers. And then in my role as a resettlement worker, working with the Syrian resettlement program, I set up a youth group for girls. It was during the pandemic, and then it continued up until last year. One of the things that I enjoy the most, or positive things I can take from the whole process, first of all, was to gain presentation skills. But then in terms of the materials, I gain a lot of knowledge about all the theories that Papadopoulos was showing us in the materials. I think that going into so much depth about the 4 phases, it was really good, just not only as a professional, but personal as well. So I think that having to learn all these phases and all this information was really good to then be able to explain it and share it with the participants of the training. And then also about risk assessment, I think that was really good. It's always like really useful to know how to assess people and assess mental health, or be able to contribute a bit in the prevention of someone that maybe might want to commit suicide or is feeling really depressed. So I think that this set of knowledge and reasons it was really positive. Yes, actually in few occasions that I was delivering the training, and especially in the conversations that we were having with the participants, I think that especially the moments that we were having case studies or group discussions, it was a good moment for each of us, even the trainers, to think about a case that we experienced and then be able to share it with everyone. And especially it was more with the culture and mental health, because working with Syrian people and working from people for other countries, mental health they have a completely different idea of what it means. So I think that it just it was familiar, because I sometimes could identify the need of someone maybe referring them to counseling or to mental health services. But first of all, I had to have that conversation to see in which point they were, or which idea they have according to the culture that they're coming from. Yeah, I think going back to this the culture and mental health, I think that it will have been really, really positive to maybe discuss more, have more materials to give participants more idea about what mental health means in other countries. Just give example, or maybe talk about suicide, in which countries maybe is allowed, or is maybe it's a criminal offense, because those aspects are really important when having the conversations in the UK, for example, or in other countries in Europe, about suicide, about mental health. I think it's very important to touch on this information, especially if we all were going to work with people from other countries. Important to know a bit that background, where they're coming from. Otherwise, it will be really challenging to have that conversation and to prevent maybe the development of mental health issues or suicidal